Good morning, everybody. This is Pat Hennessy with Beere&Purves. Wanted to thank each and every one of you for attending this morning. We've got a lot of content to cover with you for the next 45 minutes. And I wanted to let you know, I want you to relax and enjoy this presentation today. Any questions you have, please go ahead and email those in. I'm going to try to get to those at the end of the presentation today. If I don't worry, I will go ahead and answer all the questions that will be coming back to you in an email format. The presentation will be emailed to you later today, so you'll have all of the information you're seeing today in an email, so that way you'll be able to reference it going forward. So with that, I want to make sure that we make the most of our time. And again, today it's really about how you can increase efficiency within your agency. When you increase the efficiency, you will increase profitability, and we're going to share with you some specific examples on how to do that going forward. So what we're going to cover today are the resources that we have available here internally. And again, it's really important for you to understand all of the range of resources available, and please take full use of these, because these, again, as we talk about, I'm going to talk about all day long, is increasing efficiency and the profitability for your agencies. The advantages of using Beere&Purves, we're going to talk about those, and the 2018 carrier highlights, we're going to go through those as well to share with you what you should be selling in the second quarter. So let's talk about some of the resources that we have available to you. One is going to be the eCentral Specialist. We do have Ryan Moore in our office. So a lot of you on the line do use eCentral. It has become the preferred method. Right now we're seeing an increased number of enrollments coming through eCentral. Very efficient, and what we'd recommend is, what some brokers are doing is they're actually leading with eCentral, asking the new group, we'd like to go ahead and use the online enrollment tool. If they push back, if you have a blue collar group that maybe it doesn't make sense, obviously we go to the paper applications. But once a group has actually gone through the process, they are hooked, and they're really excited about using that going forward. So we do have a specialist here that can provide you with step-by-step instructions. We set it up within 24 to 48 hours, and the enrollment process is very simple. So I would encourage you, if you haven't done so, please give it a try. We do have a dedicated sales specialist team here. We have Tracy Gaspar and we have Heather Lewis, both here 8 hours a day to provide you with service, support, and really acting as an account manager for you. So please utilize them and the resources they provide. Enrollment support, I'm happy to go out. Any new group enrollments, please let me know. I can act as a carrier representative. We also have specialists when we talk about specialists, we're talking about translators. And so we do have any language that you need. Those, again, are at no cost. So should you have we're seeing more and more Spanish enrollments. Let us know if you need a Spanish interpreter, and those are provided, again, at no cost to you. So some of the resources we want to talk about. This is the network and RX searches. We have a gentleman in our office named Patrick Kim. So let's say we have a group, they're going to be moving from Blue Shield, they're going over to United Healthcare. The owner and the spouse of the owner and the 3 children, they go to 6 doctors, and they're combined are on 10 medications. So what Patrick will do is, once you gather that information, I would encourage you, on any groups you're going to be transitioning, please make sure that if anyone has a ongoing medical situation, you want to ask for that specific doctor name, and you want to go ahead and ask for the medications that they're on. What we'll do is we're going to get you a report that looks like this. And what it does, it will determine the clinics that are inside of the specific needs of that group, the doctors, and it'll tell you which ones have the highest percentage of in-network providers, facilities, treatments, and pharmacy medications. So then you know immediately which one is going to be the best fit and hopefully provide the best satisfaction for your group. So this is a tool that we now provide, and it's important for you to understand, these are the doctors, for example, in a situation that we had recently. These are all the providers, the medical groups, hospitals, clinics, and the pharmacies that were needed by this group. So we took this information, and then we went to each of the carrier websites and determined which ones were in network, which ones were not, and this is the group, this is the information that was provided back to the broker. This information was shared with the owner, and then a decision was made. This was not going to the most inexpensive carrier. This went to the one who actually had the best coverage. So this is a way you're actually providing another value-added service, and it really protects you as a broker. As these networks become narrower, as the medication, the provider groups and the formularies are getting skinnier and skinnier, the chance of something falling out and becoming an issue and blowing up is going to get higher and higher. So this is a way that you provide upfront before you move the group over. This is exactly based on the situation you provided. This is what we're looking at, and you can make a decision whether to move or not, and going in with the eyes wide open to avoid any issues going forward. Managing expectations, as you know, is the key component of this job, and by doing this, you're going to distinguish yourself as a specialist in this industry, and we can definitely help you do that. So as we go back to our presentation here, let me just bring it back up. Oh, I'm sorry, just one moment. Here we go. The other thing I wanted to share with you is once we have a group that's approved, you will receive a group approval letter. The group approval letter will look like this. You'll have the group name, the effective date, case number, the administrative kit, you'll know that where that's being sent to, the identification cards, all the new hire information. This is what you want to share with the group. It tells them exactly where we're going to send any membership information, pharmacy or claim issues. All of this is right here. So this provides great overview. Whenever you have a new group, please make sure you do send this. As soon as we get the approval, we will send this to you, and please forward this over to your group so that way they have this information handy. So now as we move on, the next thing we want to talk about is how to be a good healthcare consumer. Right now we know that 70% of all the business is really done between 12/1 and 1/1 primarily. So right now the time of year we're in is really a down time of year. And marketing now is a huge opportunity because you're not going to be as busy as you will be here coming up soon. So what you want to do is provide content. And what this does, this is anytime you have a group, before we transition them over, when we go through the enrollment process, we want to advise them of certain things. When are you going to get your ID cards? When you become eligible? What is the process with prescriptions and deductibles? How does that work? What about pre-authorization of care? So these are the items that we include in the enrollment kits during the enrollment meeting. After they are enrolled, what do they need to be aware of? Well, you should go to the new carriers portal, get signed up. You should make sure you're using the in-network providers. You're going to confirm that your ID card is current, and then you really want to be looking at how to obtain preventive care, telemedicine, and all of these other items. So this is a great tool that we've now come up with that we would encourage you to review with your group, so that way you have that as another value add. And what some brokers are doing is every month what they do is they go ahead and they're sharing content. Again, the best way to go ahead and provide new sales and keep existing groups is always providing the new content going forward. So this is something we wanted to share with you as well, and is available to you also. We do have 3 underwriters here that have been here for a number of years, so if you have any underwriting questions on new groups, please make sure you access them. They're always available for questions and answers. Pocket tools. Now, Pocket Tool is something that we have on our website, and I want to share this with you as well. So this is we see everything you're going to see branded. This is Backpack, B&P. You'll notice that we have a lot of linkage to our logo here. So let's talk about underwriting comparisons. So in this example, we had a group and we were trying to figure out which was the best for an owner-only group. There was 4 owners, no W-2 employees. So what we do in this example, we select all. We come down here, here's the owner-only question that we had. And as we come down, we hit generate proposal. So you'll notice in this example, now we know exactly which carriers will take an owner-only group. So now you know we're not going to go to Aetna because they no longer do it. We know it with Anthem, as long as that owner-only group is a C Corp or an LLC, we can write the group with Anthem. Blue Shield won't take it, CalChoice won't take it, HealthNet won't take it, United Healthcare will take it if it's a C Corp, S Corp, or LLC. This is really critical because when you go back with just providing quotes, if Aetna was the most competitive quote, the group would blow up in underwriting. So this is a great tool that we want to make sure you reference. Anytime you have a specific situation, you'll access all the carriers, you'll click on that specific situation, and the answer will appear, and you'll know exactly how to go ahead and narrow down the best carrier based on your situation. Now we're going to go with the underwriting and billing we talked about. Custom generators these are another amazing tool that we have available to you. And as we come over here, let's look at, for example, network comparisons. So in this example, we have a group that is in Alameda, Contra Costa County. That's where their employees are located. And we're trying to determine which is the best hospital facilities to go to. So we're looking at obviously the hospitals in this example, and we're trying to determine, because the pricing is very similar between Anthem Blue Cross and the Blue Shield full PPO and United Healthcare. So here we go, and then we hit compare. So this will tell you, in this example, the owner of the company had a sick child that was being treated at Alameda Hospital. And so what we did when we looked at this, we knew that on the top line here, Alameda Hospital is not in network with the Prudent Buyer or the Blue Shield. It's in network with the UHC Select Plus PPO. So in this example, we went ahead and wrote the group with UHC because the facility that we needed was not in the network with the other two that the group was looking at. These are another great way to very quickly provide a solution based on your customer's needs. We can save this as a PDF and send this over to the employer so that way they can have this information to really help them navigate and put together the best possible solution. Competitive plans by county. So what this does for the second quarter, and again, we're talking about 4/1, 5/1, 6/1 effective dates. Let's look at Alameda, Contra Costa County, and let's look at the silver plan option. If we have an existing group, and let's say they're with HealthNet, you'll notice here that there may be an option to switch them to a carrier that's more competitive. What this shows are on your left-hand side. These are all of the platinum plans, gold, and again, we just picked out the main ones that we're selling: silver, bronze, silver HSA, and bronze HSA. When you're looking at Alameda, Contra Costa counties, you'll notice there's a difference between which plans are most competitive in each of those territories. So for example, you're looking at Blue Shield is very dominant when you're looking at, let's say, platinum and gold within Alameda. But if you were to go to Contra Costa, you'll notice that the plan designs are different. It is predominantly Anthem. So this is what we're selling for the second quarter. So if your group is not currently showing these plans based on the metallic tier that's here on the left-hand side, there is an opportunity to move the group or to pick up the new group when you're doing the quote. So we just wanted to share with you how this works. And this, again, is based on that employer location. When you go all the way to the end of this document, as you all know, there are 19 rating regions in the state of California. That's how it's broken up. Where that employer is located in each of these 19 areas here, that is the rates that you're seeing, and that'll tell you which plans are most competitive, which makes this very helpful as you're looking at new. If the existing group already has the most competitive plan in place in force, then there may not be a need to move them at all. So that's something to give your first level of triage. You want to look at that. So as we go into our next page, now we're going to talk about some of the advantages of working with Beere&Purves. Again, we have a local presence here. We're basically at right off Treat here in Walnut Creek. And some of the things we want to share with you now are regarding legislation. And this is really where it gets tricky. We're finding more and more groups are not in compliance with the specific notices that are being mandated by law. And for those of you that are out prospecting, looking for new groups, what we really want to focus on is making sure that you have a compliance checklist. And it's basically going through an audit with your groups, and you should do this obviously with your own groups first to make sure that you are in compliance with the most current notices based on group size. There is a specific list of notices for groups that are between 0 to 19 employees. for those that are 21 to 49 and those that are 51 and up. And these things we wanted to make sure you're familiar with it. Right now, when the timing is we have a little slower time of season, please go through your groups, make sure that they are in compliance. And for those of you that are prospecting, use this as a wonderful tool to generate new opportunities, because many of these groups are not in compliance. So we talk about 6055 and 6056 reporting. This is the tool that we have available for you that you can send out to your groups. And again, the way this works is if the group is over 50. If it's over 50, then, and they're a fully insured plan, there are reporting requirements in order for this Form 1095-C. The employer must send that in and have that completed in order to be in compliance. If your groups are under 50, this is all done by the insurance carriers. So the health coverage providers are going to be doing that for you. But for those of you that have larger groups, you really want to make sure that you're aware who is doing this, how it's being done, because you're looking at the general penalties down below. It's up to $250 per return for failing to timely file the returns that are listed on this page. So this is a great document as you're going through to understand what it is, how it works. If you need filing assistance, the two vendors that we have a preferred relationship are with Sterling HSA and with Task, and that information is listed there for you. Pay or play. This is another legislative item that we want to make sure you're aware of. This is a document that we're updating right now. It goes through what it is, how does it affect you, and again, now we get into all of the pay or play rules, the look back, the measurement and stability period. This is very complicated, and this document here really makes it easy to understand what it is and how it works. Now, pay or play is for groups. As of January 2016, there were employers with 50 or more full-time equivalents. They must comply with this pay or play mandate. And that simply means that coverage must be offered to at least 95% of the full-time employees. If the offered coverage is deemed unaffordable or doesn't mean 60% of the actual very valuable, there's a problem. So this is something that you want to make sure your groups are aware of. And when you run across groups that are over 50 that aren't providing health insurance, they must comply with pay or play. And this is a good tool to share with them so that way they understand the rules, and it's another value that you're providing as a broker. The next one is the healthcare reform checklist. And as I mentioned, there are 3 of these that we have available. This happens to be the benefit notices for employers that are 1 to 19 employees. And what this does, if I am a 12 life group, I have to understand that I am required by law to have a summary of an SPD, the summary plan description, and that has to be sent, is provided to the group health plan participants within 90 days after the employees become a participant in the plan. So this tells you what the notice is, who provides it, and when is it due. You'll notice that for groups under 19, look at all of these notices that are required by law. And there's a plan document. And as we come down, now you're going to see a transmittal form. Now that one's for self-insured only. There's a health insurance exchange notice that must be given to all new employees within 14 days of their start date. A lot of times that is not being provided. The summary of benefits and coverage and uniform glossary, that has to be provided within 90 days of any kind of a special enrollment. A notice of modification, disclosure of grandfathered status must be provided. A notice of patient protections, this is required. The patient center outcome fees, all of this is unbelievable. We've done a number of audits, and we have not had any of the carriers, when we've done these, any of the groups have passed with 100%. So what this shows us is it's really important for you as a broker, first of all, to understand what these are, and then secondly, to make sure your internal groups are basically in compliance with all of these notices that are required by law. If they are audited, they will be subject to fine, and employees could potentially file litigation against the employer. So that is why it's extremely important now, especially, to make sure that all your groups are meeting all these requirements, and that you as a broker have advised them to make sure that they get all these done. So this is something we can provide you with as well. This is extremely valuable, and now we can't stress enough, it's a great time to go out and do a compliance audit on all your existing groups and your prospects. Anthem EDI, oh no, actually let me go on to this Medicare Part D status. You hear about this all the time. If I have an employee who works with me and they're 66 years old, I have to make sure that I'm providing them with a health plan that provides them with the same level of pharmacy benefit that they would get if they were on Medicare. Basically, it's a creditable, means that it is a plan design that is legitimate and meets the criteria for that employee who's Medicare eligible. So when you're looking at this, you'll notice that most of them are creditable, so we don't typically have issues until you get down to the bronze section. You'll notice here on this bronze plan within Anthem, these plans that are the 4,500, all these HSAs, these are non-creditable plans. So this is where problems erupt when you have older employees that are on plans that are not creditable. This is a document that has to be submitted, and if there's you have to make these employees aware if they are on a plan that is not creditable, because this has financial implications that could negatively impact them. So this is another great resource as you're going out with tools, just to make sure you're educating the HR managers which plans are creditable, which ones are not. And you'll notice there are a lot of them in the bronze area that are not creditable, and these employees really need to be made aware if they're selecting a plan design, because as you know, we are in an age-based environment. So as the employee ages, the cost becomes more expensive. So if I'm 66 years old, I can't afford a silver or gold plan. I may have to take a bronze plan, but you need to let me know that what I'm selecting is a non-creditable plan and could have a negative impact on me going forward. So this is a great tool that you'll have access to again, provide education to the groups and specifically those older employees. And a lot of times, unfortunately, they're simply not aware that there's a problem out there until it's too late. Anthem EDI, we are very fortunate to have a great relationship with Anthem. Typically what will happen now is we have groups that are submitting groups. Let's say a group moves from Blue Shield over to Anthem, and the enrollment is sent to us at 9 o'clock in the morning. We will have your individual ID numbers for each employee and the group number back to you by 5 p.m. that same day. This is what we've been doing on a consistent basis, unless there's something that's unforeseen happens. But the turnaround times are unbelievably fast, and we're one of the few GAs that have that access to Anthem, and I want to make sure you take full advantage of that, especially as you're doing enrollments towards the end of the month. This is a critical piece that is really going to put you in the good favor with those groups. As you know, most of the groups come in at the last second, and then they're all beating you up for an ID number. We can get those numbers for you very quickly. We now have the ability to quickly download SBCs, so if you do need those, we have the website that'll do it. If you have any questions on or need those, ask Tracy or Heather and they can provide those to you. And the next one is back office support for adds, deletes, claims, and resolutions. So anytime you have an add or delete or a claim issue, let Tracy or Heather know. If they cannot resolve it, we have a gentleman named Randy Halsey in our office that meets with the carriers on a quarterly basis. Excellent relationships with the senior management teams at these carriers, and we are very fortunate to get a lot of special exceptions when we need it. So please let us help you in the situations where you get a no. Make that your opening negotiating position, and we can hopefully take care of that for you. And we do a high percentage of those get approvals. So now we're going to move on. Let's talk about some of the medical updates. And again, what we're talking about now is for the second quarter. What do you need to know for the second quarter? Let's talk about Aetna. So Aetna is very competitive in the bronze plans that we're seeing across the board. So if you're starting to sell bronze PPO, Aetna is going to be one that's going to be showing up. The one thing we want to share with you is that the the rates, 4-1 rates, those are already available. And then the big thing here with Aetna is that if you have groups that are 20 more enrolled, you do not need a DE9C or prior carrier bill. All we need is the check, the employer app, the employee apps, and we're good. So that's very helpful. So keep that in mind for Aetna. The second one, and this is what you saw for Contra Costa County, we're having a lot of success with Anthem. So we have the second quarter rates available. The one thing I want to share with you are some of the things that we've seen across from time to time that pop up, and we want to avoid you having basically having a situation where the group that you enroll is going to run into a snag down the road once you submit the group. So one of the issues we did see, unfortunately, was with Anthem, you cannot have a narrow and a full PPO plan. So we had a broker who went ahead and enrolled a group. They made the base plan the select PPO, and the buy-up was to the full prudent buyer plan. You cannot do that with Anthem, so please be careful of that. You can offer the full and the narrow on the HMO side, but not on the PPO side. The second thing we want to share with you is with 6 or more enrolled, all you need is a prior carrier bill in lieu of the DE9C. This is extremely helpful. So if you have groups that you're struggling with, 6 or more enrolled, as long as they're on a prior carrier bill, Anthem will take them. Very helpful. And the next one is 5 or more enrolled, all you need is 30% participation. We had a group, it was 15 bodies. We had 10 that were in California, and we had 5 in Nevada. The 10 in California wanted to go on to Kaiser because it was the most affordable option. The other 5 in Nevada, obviously they cannot have Kaiser because they're out of state, but they went on to Blue Cross. So we had 51% of the eligibles, which is 10 out of 15, were in California, so we had 51%. And we did have in that example 30% enrolled. So these are great solutions to problems that you're going to come up with from time to time. And some brokers may not be aware of how these can work, so it's a good opportunity for you to pick up new groups where some folks may feel like there's not a solution for them. So keep that one in mind. The other thing is individual coverage. Whenever you run across restaurants, industries that have a high transient kind of employee population, the individual coverage is something that we do see a lot of, and not every carrier treats an individual, each individual coverage as a valid waiver. Anthem does. It makes it easier to meet participation because of it. And startup friendly. Anytime you have a startup group, you want to consider Anthem. As long as you've got the California Business Portal and that group is showing as active. For example, if we're going to have a 4/1 effective date, if our new group is going to show up as active on the business portal as 3/28, they can have a 4/1 effective date with the payroll starting on 4/1 and the coverage starting 4/1. Very easy. So this is something for any startup groups, which we are starting to see more of because the economy is improving. Please go ahead and use Anthem. They're the friendliest when it comes to startups. The next big winner that we're seeing now in the second quarter is CalChoice. And the reason being is because of Kaiser. So Kaiser, the rates are the same and the benefits are exactly the same with California Choice in 2018. So we are starting to see a lot of groups migrate from Kaiser Direct over to CalChoice at renewal only. You cannot take a group 12/1 with CalChoice and move it 12/1 with Kaiser Direct and move it to 4/1 with CalChoice. It has to be at anniversary only. The reason we are starting to see more activity with CalChoice, number one, is that the unemployment rate is at one of the lowest levels it's been in years currently, and employers are struggling to find labor. And when they're trying to hire and retain qualified employees, they need to become as flexible as possible to make sure that they meet the needs of the population. So if I have a sick child and I want to work for an employee who's got Kaiser only, but I'd love to have access to Stanford, I can't do that necessarily with Kaiser Direct. But if I go to CalChoice, the Kaiser folks can have Kaiser. I can go to Stanford, or I can go to a premier medical facility within either United Healthcare or within Anthem and it just creates that level of flexibility that an employer really needs now in 2018 to attract and retain a competitive workforce. So that's what we're seeing in with CalChoices picking up, and our sales are increasing because of that. The commissions, as you know, have dropped from 6.5% last year to 5% this year, and that's consistent with most carriers across the board. HealthNet is our next carrier. You'll notice that HealthNet, we did not see a lot of HealthNet on our competitive sheet. One of the things they did come out with today, and this is hot off the press, is that if it's a group 1 to 5 eligible employees, 66% participation is all you need. And then if they are 6 to 100, all you need is 35% employee participation. So this is really important that the carriers are getting more and more competitive and lowering their participation requirements, which is going to make it easier for you to write groups, which is nice. And the last medical carrier we want to talk about is United Healthcare. With United Healthcare, they're very flexible because all you need if you have 10 or more enrolling is a signed participation certification form. They do not need a DE9C. Also, when you go alongside a Kaiser, for example, we had a 90 life group. We had a scenario where with CalChoice, you have to have the adjacent metallic tiers. So we had an employer, they had a silver and bronze option. They had the management team on the silver, they had the employees on the bronze. They were trying to figure out how to provide a richer benefit. So what they did was they moved the group from CalChoice to Kaiser Direct. They put the employees on the bronze Kaiser, and they moved the management team. Well, everyone was offered the plan, of course, but some of the managers wanted a richer plan, and they offered it. So some were offered a platinum, and that was through United Healthcare. So with 85 bodies, we had 5 enrolling with United Healthcare in California. It's 90, and 5 went to UHC California, 85 went to Kaiser, and that's how the group was done. So there's a lot of flexibility with United Healthcare alongside Kaiser. The other flexibility is with groups that are out of state. United Healthcare is your most flexible option there, so I want to make sure you're aware of that. The last thing I wanted to share with you is if you have 1 to 2 life groups, they're taking a lot longer with than the 3+ groups because you have to use the ACH form and they're auditing those groups a lot more stringently. So just some things to be careful of with UHC. Now let's talk about ancillary. Ancillary never gets the recognition and the time it deserves. With the majority of the medical groups being done, now's the time to look at ancillary. And for those of you out marketing, a lot of groups really have medical only, and now you should be talking about ancillary as a foot in the door. And those of you that are the account managers, you always want to be adding additional lines of coverage to your existing groups, and now is the time to do that. So with Anthem, you have no DE9C. They offer really rich benefit plans for the dental. You get the implants, the composite fillings at 80–90% UCR. And you'll notice that all of the plans have endo, perio, and oral surgery under basic with no waiting periods, which is very unusual. So a lot of brokers don't give Anthem the time of day when it comes to ancillary. We would encourage you to do that. The rates are very competitive. And for groups that are under 10, we would encourage bundling with your existing medical carrier. So our average group size, let's say, is 8. You want to go ahead and put your medical, dental, vision with one carrier. It makes it easier for that carrier, for that group. And it also, for some carriers, there's bundled discounts as well. Choice Builder is another very competitive carrier. That's our number 2 carrier right now. Very flexible, no DE9C required. Delta Dental is our number 1 carrier, and they've had a rate pass since 2014, so that's good. We also offer Guardian. Anytime you need rollover plans, Guardian is a great option for you. MetLife has a number of discounts when you go ahead and package together. United Healthcare also, when you package it with the medical, the savings there can be significant, so keep in mind of that. Also, if you need LTD, they go down to 2 with LTD, so very helpful with United Healthcare. Principal is our newest carrier we want to share with you. We're having a lot of success with Principal as well. Very competitive rates and no DE9C required. And the last one is VSP. They've had a rate pass in 2018. And again, the pricing going through Beere&Purves versus direct, the cost is exactly the same, so there's no load. So that's helpful to know as well. The one new thing I wanted to share with you, and we're always trying to introduce and provide you with new information to go out to your groups with. Anytime you set up a meeting with your group, you've got to provide value. You've got to show them something new. So that way there's a feeling that you're always, you got your finger on the pulse of what's going on in the marketplace. So what's happening now with Delta Dental, there is a new product out we wanted to share with you today. It's called Personal Protection Plan. The way this works is you have 4 services that you get. One is called Teledoc. You can access your doctor over the phone. 2 is emergency services. If you're stranded and you need emergency help. Legal assistance, and ID theft. So you get those 4 items for a cost of $6 per employee per month. Now this is 100% employer paid. All employees, even if I waive off the Delta plan, I have to be enrolled in it. And it covers myself, my spouse, and my children. And there's a commission of 10%. So when you're looking at, and again, if I'm an employer struggling, I can't really provide richer medical benefits, what I may want to do is add this Delta Dental Personal Protection Plan. For as little as $6 a month per employee per month, I can go ahead and add these 4 items. And these are very rich benefits that for an employee, if they ever need it, this could be a lifesaver. So I wanted to make sure that you're aware of this new product. We can go ahead and get you the pricing for it. Whenever you ask for a Delta Dental quote, always ask for this personal protection plan. We will include it, and it's a great way to add another line of coverage to that existing group and another revenue stream for you as well. Now let's talk about Canopy. I'm sure a lot of you have heard about Canopy. You're seeing the advertisements on the radio, on the buses up and down the East Bay. This is something you want to pay attention to because what's happening is a lot of the business, as we know, is shifting to Kaiser, and the non-Kaiser providers are trying to figure out how to stop that flow. And what Canopy has done, again, what it is not is you have, for example, we have Western Health Advantage, which is a provider and an insurance company. You have Sutter, which is a provider and an insurance company. And then you have Canopy. Canopy is a provider network. It is not an insurance company. So it is different. So the provider network has to attach itself to an insurance company, and that's what Canopy does. So with Canopy, you have access to hospitals. So we talk about John Muir. We talk about, or you talk about the, when you're looking at medical groups, you have John Muir, you have Hills Physicians, and you're looking at the Dignity and Meritage. And so what's happening is if I live, or if my employer is in the East Bay, I'm able to go ahead and access Canopy Health at a cost that is less expensive than your traditional PPO plan designs because it is an HMO. Also, I have access to UCSF, and that is big. UCSF, one of the premier medical facilities here in Northern California, you get access to that at a discounted rate. So when you're talking about Canopy, what you want to explain to employers is that it is a lower cost option to access premier medical services and facilities. So the way it works, it is available through 2 carriers, number 1, that we represent. Number 1 is United Healthcare. So when you quote Kaiser alongside United Healthcare, you're going to quote UHC with the PPO plan designs, but you also, please make sure that you add a quote to include the Signature Value Advantage HMO network within UHC. So that is your narrow HMO network, and that is where the Canopy rates are located, because you're not going to see Canopy listed there. The Canopy rates are the Signature Value Advantage HMO rates within United Healthcare. Those are how, so when you provide your rates to your group, they're going to see Kaiser Direct, they're going to see UHC, which is going to have the Signature Value Advantage network, which are going to be competitive, not as competitive as Kaiser, but they'll be very competitive. And then you'll have the PPO plans for United Healthcare as well. This gives the employees the option that they may not be able to afford the full PPO plan, but they can definitely afford, in many situations, the Signature Value Advantage rates and access John Muir and then go to UCSF, which is what most employees want to do. The other way to access Canopy is through Western Health Advantage. and this is through CalChoice. So as we mentioned, we want to provide the maximum flexibility for our employers. So what we do is we provide a quote, and if that employer lives in the Bay Area, we quote Western Health Advantage. That way those employees that are living within this network can have access to the Canopy network. Those that want Kaiser can have Kaiser. Those that want, and we'll put them in Western Health Advantage, if they're in the Bay Area here, they will have the Canopy network. If the group is in Sacramento, they will have the Western Health Advantage network. So that is important to know. So we would like to see more quotes that are generated showing the Canopy option. I think those that are selling right now, it's important for you to offer it, because we do have brokers that are leading with Canopy and basically offering this to groups. And if you as the incumbent broker have not at least offered it, it won't look good for you, because we don't want to see anybody lose any groups as the incumbent. So use this to attract new groups and use it to retain existing ones. Showing them the option is critical, because a lot of them are hearing about it. They're not understanding how it works. If you have any questions on how it works, please let me know. But at the end of the day, it is a physician network, 4,000 doctors, growing rapidly down to the Santa Cruz area. It provides access to, it's an HMO, but typically when we think of an HMO, we think of a limited provider network where all your specialists have to be coming from that medical group. With this, if I have a doctor, primary care doctor at John Muir, that John Muir doctor can refer me to UCSF, which is unusual. And typically, a lot of the John Muir doctors don't have access to that type of referral program. So it gives you the best of both worlds, a very competitive price, but access to the premier medical facility in Northern California. So keep that in mind, put Canopy on your screen and talk to your groups about it, because it's another option that is very competitively priced. And as a lot of these employers are trying to figure out more cost-effective solutions, this is one you want to be showing. 2018 medical updates. This is important to understand and explain to your groups as well. When we say that small group, for the most part, they had a single-digit rate increase, a lot of the employers are so happy to hear that, and they're just going to stay with the existing incumbent carrier. However, individuals within that group are going to get crushed, specifically those who have children that are between 15 to 20 years of age. Because last year in 2017, anybody between the ages of 0 and 20 paid the exact same rate for those children. And the way you want to think of it is that rate was approximately 64% of a 21-year-old rate. So when an employee last year jumped from 20 to 21, let's say there was approximately a 40% increase in premium. So what was thought about this year was, let's avoid that big jump. Let's go ahead and gradually increase the premium over time as these kids age. So that way the employees won't experience that big jump. The problem is the cost impact is going to be worse this year, because instead of being between 0 and 20, being a 64% of a 21-year-old rate, it's between 0 to 14 is the first age band, and that now jumped to 73% of a 21-year-old. So that already jumped 20% last year versus this year. And every time a child ages, 15, 16, 17, the rates will go up, as you see on the bottom of the screen. So between last year and this year, if I have a 20-year-old, my 20-year-old rates went up 52%. And so you want to be able to explain what happened between last year and this year, because a family is not understanding. The employer is saying, we have good news, we have a single-digit increase on our medical plan between that last year and this year, but me as a family with 3 kids, I'm experiencing something significantly higher because of the way the rates have changed for children. So please be mindful of that. The required notice checklist. This is one of the things we wanted to share with you, because what you can do, depending on if your group is 0 to 19 employees, 20 to 49, or 50 and up. This is a single-page document that tells you exactly what the requirements are that should be provided to each of those employer groups. And this is something you can take out. You can do an audit with your existing groups. When you click on this, it'll tell you exactly what that document is, so that way you can have an understanding before you meet with them. And if you find that you're deficient, you want to make sure you take corrective action immediately and let us know. Anybody who has questions, the vendors that we use are HR360, Sterling, HSA, and Task. They provide complete service to make sure your groups are in compliance with all of these required notices that are listed here. So let us know if you have any questions with that, and please make sure you take advantage of this, because we don't want to see you lose a group because of an issue that you did not make them aware of. We are running out of time here, but the last couple of things I want to share with you, eCentral, we do have the ability, we have a full team here in place to provide services for that. All we need is there's a questionnaire that we need advising as to which groups were sold, plan selection, and we can get that set up for you very quickly. Also, anytime we sell a group with you, if you want to use the eCentral services, those are at no cost to you. And what we will do is we will pay $1.40 per head per month to your eCentral account if you have it, to offset that. So for example, if you have a 30 life group, we pay $1.40 times 12 is $504, and we pay that to your eCentral account, lowering your cost of doing business and increasing your profitability. If you don't want to use eCentral, we can pay for any of the other services that are listed here. And again, the goal is to be a partner with you and to share those expenses to increase the profitability to your office. Our partner services are here. So as you're going through, look at the job descriptions within your office, figure out what can be offloaded and how to free up internal capacity. That is going to be key. And as the commissions are starting to trend in a downward direction, offloading to a GA, especially Beere&Purves, who has all of these services here, is a great way to increase profitability because you're reducing your expenses. We want to stay connected with you. We have Twitter, LinkedIn, YouTube, texting, and emails. And I want to thank each and every one of you for joining us today. Again, all the information we covered is going to be sent to you this evening in an email. If you have any questions on anything we went through today, please let me know. Thank you so much, and happy St. Patrick's Day. Take care. Bye-bye.